In this panel discussion, we have parents of children using cannabis, and they are going to share their experience using cannabis with their children and their activism in the cannabis space. Starting with Hera Osborne, the mother of twins with Fragile X syndrome. She is an activist on many organizations and the original co-founder of the strains product line in initially Colorado. Hera?
Good morning. Thank you very much. So my story began 5 years ago when a good friend of mine who had heard about cannabis and how it was changing lives, like you said, Ken, in Colorado, for families that had children that had seizure disorders. My girlfriend shared this information with me, along with some of the products and family stories. I was hesitant because I grew up in a family where cannabis was, you didn't even discuss it. It was taboo. So I tried using it with my son, just CBD, strictly CBD, and didn't really notice anything at first. Had to up the dose, and immediately when we hit the proper dose, we saw huge improvements. Shortly after that, my son suffers, like Kent said, from something called Fragile X syndrome, which is the leading genetic cause of autism. His body, he lives in something called fight or flight mode, which means his body cannot relax. So for 8 years of his life, he didn't sleep. So unlike a lot of the parents that I have met through this journey, my son is a user of something called RSO, Rick Simpson oil. Without it, he wouldn't sleep. When we first tried it, I was absolutely terrified, and it had been 14 nights that he hadn't slept in a row. We used a little tiny rice grain on a banana, gave it to him. I sat under his nose all night long, making sure he was breathing because he was able to fall asleep. So our journey has been absolutely incredible because from that night on, our lives had changed. So I am excited to be on this panel today and look forward to sharing a lot more with everyone.
Thank you, Hera. Next, we have Sebastian Coate. He is Jager's dad and the co-founder of Georgia's Hope and the National Education Director for Flowering Hope Foundation. Sebastian?
Yes, hi. Thanks, Ken. Appreciate it. And happy to be with you guys here today. My story actually started, or Jagger's story, is my little boy. He has a very rare form of mitochondrial disease called Lee's disease. It's very rare and it's progressive, and there's no cure for Lee's disease. So Jagger was actually put on hospice in late 2011 and put on a ton of medication to try to just make what he has left for his life as comfortable as possible. In 2013, one day just watching TV, I saw the documentary Weed on CNN. And all of a sudden, I say, well, this is very interesting. Cannabis. Could this help Jagger possibly? So start doing some research, met with some other parents in Georgia. We co-founded Georgia's Hope at the end of 2013 to try to pass medical cannabis bill here in Georgia. We were not able to do that. So in August of 2014, my wife, Annette, Jagger, and I decided to move to Colorado and become medical refugees so we could try medical cannabis for Jagger. Our hospice team told us that it would be 50-50 chance he would not survive the trip. We were not allowed to fly with Jagger because we almost had an emergency landing once, so we are blacklisted from flying commercial airplane. So we drove to Colorado. It was a horrible drive. It took us 6 days. We had to stop every 3 hours because Jagger was doing so bad. He would stop breathing. We were running out of oxygen, so we had to go to a hotel, calm him down. We made it to Colorado. We made it there, and we got a medical card almost right away. And on August 20th, 2014, we gave Jagger his very first dose of Haley's Hope Medical Cannabis CBD first. Kind of like Hera's story, we started with CBD. And we saw some very good improvement right away, mostly in his behavior, eye tracking, recognizing us, smiling again. He hasn't smiled before that for probably a couple of years. So that was a big deal for us. And we were in Colorado for 13 months. We were able to add some more cannabinoids to his regimen, play with the dose. And now Jagger is 7. He's 3.5 years, 3.5 years past his most optimistic life expectancy from any doctor, as 95% of least disease kids do not make it past their 4th birthday. We are back in Georgia. But Jagger is doing as good as he's going to do. He's still on the hospice. He's still a terminal patient, but his quality of life has increased dramatically because of cannabis. We were able to reduce his seizures from 10 to 15 a day to 3 to 4 a day. We were able to reduce his pain crisis, where his muscle would get so tight, he would be in a lot of pain. We were able to reduce that by about 90%. We got him 100% off the Oxycontin and about 95% off the morphine just by using THC. So, great. Again, it's not a cure for him. He's still a terminal patient, but great result. We're very excited and very happy about everything cannabis has been doing for Jagger. And I'm looking forward to share a little bit more of that and the struggle we're having also in Georgia to get the product that we need. So that's my story.
Hera, could you describe your experience on how you got to the point of cannabis?
So as I had stated, my son has Fragile X syndrome, which leaves him, he's nonverbal, still in diapers at 14 years old. When he was 6 months old, he had his regular scheduled immunization. And shortly, about 15 minutes afterwards, he had still not stopped crying. I took him home. We dealt with high fevers, nonstop screaming and crying. The point where the needle had gone in was swollen and inflamed. I ended up calling the doctor's office and thinking that they had left the needle in his arm. Unbeknownst to me, I didn't know about the MMR shots and the thimerosal at that time. I don't share that part of the story lightly because I believe that people should responsibly immunize, but at that stage, I didn't know that he was a carrier or that he had Fragile X syndrome. So I didn't know that he was predisposed. We ended up changing pediatricians. He never looked at me again. He didn't make eye contact when I would nurse him. He wouldn't latch on. So from that day forward, things changed. Progressively getting worse as he got older. We did early intervention. We never experienced the impact of the change as we did with cannabis. We were involved in several research studies that involved minocycline and several other pharmaceutical drugs, and just it never worked well for our son, unfortunately. From the very first day that we tried Rick Simpson oil, we had great success. My son would sleep all night. He would wake up available to learn the next day. His behaviors were getting better. His self-injurious behaviors were getting better. And it absolutely changed every aspect of his sleep patterns. The CBD in conjunction helps my son with his seizure activity. So that reduced greatly. Cannabis has changed our lives. And instead, we were at a point that, we would have to go to California to purchase it, come back to Nevada where we live. And we thought, we don't know who's making it. And the consistency was sporadic. And so we thought, we wanted to do this as parents responsibly. We wanted to provide an option for other families to be able to access medication that really worked for their children. We saw how it changed our lives. So, here we are 4.5 years later, providing medicine to some of our friends that we had shared our stories with. And we're building different walls. We're building walls around families where they feel protected that their children can take cannabis, because the government walls that have been built around our perception of what cannabis is really about are so wrong, and they're crumbling down now. And thank goodness for other parents, such as myself, that are able to share their stories. Sebastian sharing his story with his son having a quality of life. There are so many other people out there that have similar stories that are afraid to say anything about it because they don't want to be judged or blackballed from the community. So doing this responsibly is so important. And, admitting out loud that, our children take cannabis and the highest forms of THC cannabis is scary. But when they see the difference in the quality of life, when a child can go to a playground and play, or when a child can sleep all night long and enjoy the luxuries of waking up and not being exhausted, we have to speak loud. So that's why I'm on the panel today.
Sebastian, what else would you like to share?
Well, I think kind of like Hera said, it's a little bit scary when you first come out. And well, first of all, when you first use medical cannabis for your kid, because there's such a stigma for so many years that it's something so bad, then you actually worry a little bit. Are you going to hurt your kid? Are you going to make things worse? Our situation being on hospice, we didn't have really a lot to lose, right? At the end of the day, we had to try something. We had to try something with Jagger. He was on, Oxycontin, morphine, Valium, methadone, gabapentin, baclofen, crazy amount of meds, unlimited amounts, because when you're on hospice, it's all about stopping the pain or stopping the suffering. And if you end up overdosing in the meantime, then so be it. So it's a sad reality of hospice care, but it's true. So it was definitely a little bit scary, but we felt like it was the right thing to do. We didn't make this decision just like this very quickly. Once we did not pass a medical cannabis bill in 2014, early 2014 in Georgia, I actually took a week vacation from my job and I went to Colorado for a week. And I met with doctors, with parents, with growers, went to dispensaries, and I really tried to get the most information I could to make the best decision. And within just a couple of days of being in Colorado, I just knew that's what we had to do for Jagger. I didn't know how we were going to do it, but I knew we had to do it. And I went home, talked to my wife. She was on board right away. And, we put everything in place. We had to transfer the hospice care to Denver. We have to get the doctor on board. Some were not on board, but we say, we got to do this. We're going to move to Colorado. So that was, it's not easy. Becoming a medical refugee is definitely one of the most challenging things you can do, because you're leaving not only your family behind, your friend, your support system, your church, if you have a church, your doctor team that took care of Jagger since the first time he got in the hospital when he was 3 months old. All those people know him really well, his doctor team. We had to leave everybody to get to Colorado. So that was very scary. And then on top of that, there's a financial aspect. Colorado is very expensive. It's not easy. Colorado is more and more expensive now as more and more people are going there, becoming medical refugee. So, it's a very long journey. It's a very hard journey, but it's absolutely worth it. 100%. I would do it again if I had to. The only reason we got back to Georgia was because Jagger was doing much, much better with everything. The seizures, the pain, the awareness, the happiness. The only problem with Colorado for us was the altitude. Jagger never got used to the altitude, and because Lee's disease at the base, it's a respiratory-based disease. There's lesion in the basal ganglia. They eventually moved down to the brainstem, which is a part of the brain that controls the breathing. So most kids with this disease end up passing from respiratory failure. And we tried for a year. We adjusted his BiPAP. We adjusted his oxygen. We really tried to give him time to adjust, and his lungs just never adjusted. So that is the reason why we moved back to Georgia. And that was very challenging too, because here in Georgia now, we do not have access to cannabis. We have a legal right to have possession of it, but we cannot legally buy it. There's nowhere to buy it in the state of Georgia. And this is why we're fighting with Georgia's Hope and other groups to try to get that change. But for Jagger, we just have to come back for the breathing. But we do miss Colorado. We miss the freedom we had in Colorado. We miss the options we had in Colorado. But, you know, cannabis is still keeping Jagger alive. It's much more challenging to get it. But, you know, as a dad of a sick parent, as a dad of a sick child, you do what you got to do for your kid. So, you know, that's what we're doing. And we're trying to make Jagger's few months, years that he has left with us the best possible.
How has the medical community in Georgia embraced the use of cannabis, and how are you acquiring the necessary medication for Jagger?
So how am I acquiring? I'm probably going to have to play the fifth on that one, just because, let's just put it like this. Somehow it gets here. Once it's here, it's legal because we have a medical card. So we have legal possession of up to 5% THC oil. We do have a limit on THC in Georgia. But obviously it's illegal to get it here. But once it's here, we have it. So we get it here. We find ways. We get it here. And once we have it here, we're legal. As a medical community, that is very interesting because at first, I remember when we started this in 2013, they were not in favor of this. Other maybe even his hospice nurse, because she said, you know, anything that can help without giving so much opiates, then I'm for it. But everybody else, his neurologist, his mitochondrial disease doctor, everybody was just kind of like, cannabis, you know, we need more research. We don't know a lot about cannabis. You know, maybe there's a lot of side effects. And my answer was possibly, but I can promise you the side effects probably be a lot less than the morphine you're giving him, the Oxycontin you're giving him. And at the end of the day, if you make him feel better, I'm going to try it. And I don't care about side effects. With Jagger, you know, being on hospice, it makes things very different. You don't worry about what could happen in 2 or 3 years from now. You're worrying about today and tomorrow. So what happened with Georgia is a lot of parents, like Hera was saying, share the story. And a lot of parents came out and show up at the Capitol, went to the media, and we really started this movement, and we shared our story, and we had kids having seizures on the floor of the state Capitol, and that make people change their mind too, as sad as it is. And by sharing all the story, all of a sudden, you know, people were using CBD, then THC, then combination of things. And the doctor was saying that it was working better. And slowly but surely the medical community is starting to embrace this. And as of today, we still have a long way to go, but we do have doctors willing to learn, doctors willing to hear the story. We have doctors signing for the cards. We have 4,000 people on the registry, and every one of them has had to have a doctor sign up for the card. And we're doing presentation and talk. Just a few months ago, we did a talk at Emory Hospital here in Atlanta, and we had 75 medical professionals show up to listen, to learn Cannabis 101 basic training, just to know what is CBD, what is THC. It's very basic. We had 75 medical professionals showing up, which might not sound like a big number, but for Georgia, the deep south, it's a huge number. And slowly but surely, we're getting people to change their mind, and we're getting doctors to come on board. And the kids, honestly, the kids is what makes a difference. Sharing the story, it was doctors seeing how cannabis can help the kids has made all the difference in the world.
That's tremendous info, Sebastian. Hera, what challenges have you run up against with your twins? And maybe you want to mention a little bit about how your daughter has found success with using CBD.
Absolutely. The biggest challenge with focusing on my son for a moment, the biggest challenge that I have found was consistency. As we were ramping up and getting the applications in and being able to make the products, even now, the consistency, it's an agriculture-based, medication. So making sure that you have a consistent product that time and time again, when utilized, is going to work. So the CBD, never a problem. The Rick Simpson oil, we found challenges with, unfortunately. So we are always looking, because as we all know, every day this industry is getting better, offering more products. So I think that that's been the biggest challenge outside of, people, the medication itself. My daughter's diagnosis manifests itself in quite a different way. Like I said, this is Fragile X, so females have 2 X chromosomes. So she has full mutation, Fragile X, but fortunately she's fairly high functioning, even though she has the full mutation. It manifests itself in being very shy, being very literal, having very, very high anxiety, not behaviorally, but, within herself. So CBD has been the biggest blessing for her, because any event that she has to go to, she knows now at 14 years old, I'm going to take a dropper of CBD and I'm going to feel better. I'm going to have my personality and I'm going to be able to go in and take care of this. So that's very, very exciting. It's, quite a contrast in comparison to her brother, who can't even access his environment on his own. Like I said, he's still in diapers, nonverbal. He can't feed himself. He can't get himself a drink. He can't do anything. So the Rick Simpson oil really helps in conjunction with the CBD for him to be able to have imitation skills and talk to us on his augmentative technology to be able to access his environment. So even though we've had the challenges with consistency, this by far has been the best fit for his needs. So win-win, in my opinion.
Thank you so much for that wonderful information. I'd like to turn the conversation now to Janie Nadler, the mother of Riley and the co-founder of Riley's Smile Foundation and Riley's Foundation nonprofit. Janie?
Hi there. So Riley was diagnosed with bone tumors when she was only 7, and the bone tumors ate away her palate, her maxilla, her cheek, and the bottom of her eye orbit, and it was extremely aggressive. So when they went in and had to remove the tumor, they essentially removed about between 1/3 and 1/4 of her bone structure of her face. And at the time, there was not a chemo that would really help get rid of this tumor, keep the high recurrence rate down enough. So, of course, as a mom, you do all kinds of research to save your baby. And so cannabis kept coming up. And in our state, it was only legal for adult, was not legal for pediatrics. But, that's not going to stop a mom on a mission. And we were able to find safe access to, safe as in it was from a dispensary that was, had lab testing, not safe as in legal. But we were able to acquire it, to have it sent to us, and I was able to use that for us. We started seeing benefits as in pain management immediately with the inflammation, and as far as benefits in her tumor and the bone structure, we started seeing those benefits within 6 months. And so it's been 4 years. She's considered stable. We're able to do her scans now in 1 year, and she's still getting followed with regular scans, and she does still have, so a little bit of damage, but on the outside, when you look at her, she's absolutely gorgeous and amazing, and they fully expected her to have, some reconstructive surgery. And so as a side effect, I call it a side effect because this is not my original intention of giving her cannabis, but a side effect was that she had amazing bone regeneration and bone growth from the cannabis. And you expect this to happen with such a young child anyway. But the beautiful regeneration that she had was definitely unexpected. How complete it was and how healthy it was and strong it was. So she did also develop seizures after her debulking surgery. It was exactly almost 2 weeks from her debulking surgery, which was a full day surgery. And I don't know if it would have happened anyway because of the trauma that she went through. But so the cannabis does help control her seizures. She's on a very, very low dose of Lamictal, and she's on CBD, THC, a very small amount of THC. She uses it sublingually. She uses sprays, nasal sprays, because that's a wonderful delivery method. And she also uses topical creams on her face for pain and that sort of thing.
That's a tremendous story. What was the response coming from the doctors that were working with your daughter? What was their response to the incorporation of cannabis and the ultimate outcome that you're seeing?
So her tumor team really didn't want to make a lot of comment because their hospital policy is not for cannabis. So they had to be very careful about what they said. I do know that they were very happy that she was finding pain relief. Their response as far as her healing and the bone regeneration was very positive, and every time they saw her, they would just shake their heads about how wonderful she looked and how kind of miraculous the bones were regenerating so beautifully, and how great she looked. When we took her for a second opinion to Johns Hopkins, that doctor, I believe, was catching on to what we were doing. He asked me, what are you giving her? And he said, I can't even tell by looking at her medical history, looking at what's been done to her, and then seeing her in front of me, I cannot tell that she's had what she's had done to her. And he said, it's just amazing. And whatever you're doing, keep doing it. And so we were using the terms essential oils because it was still illegal in Maryland, where this doctor was, and it was also illegal in Delaware. So we had a lot of people noticing that she was having these wonderful results, but because of the legality of it, we had to be very careful with the wording of what we were using. And, every time we walked out of the doctor's office, I was making mental notes. I was writing down what they were saying because they would just look at her and step back and all look at each other and just shake their heads and say, we didn't expect that. Her healing, you just can't tell that this child has been through what she's been through. And you would actually have to look at her medical records to prove that what we're seeing in front of us has had this happen to her.
Did you suggest to the physicians that were so amazed to consider this as a case study and publish it?
So we have talked to a few doctors about that. We actually had a doctor in Israel ask us, when I showed him her records, he just bluntly said to me, have you had a case study done on this child? And I said, well, we have mentioned it to a few doctors who treated her, but they fear for their job. So where we live and the people that they work for, they're walking a very fine line. So they have to be very careful of, promoting to use this for this type of tumor. it's very new in our state, and the medical community is not really for it just yet. They're very on the fence. And to put it, bluntly, we live in an AI DuPont state, and AI DuPont is really on the fence about it. And so that is our struggle right now, is to educate the medical community, which is one of the reasons I was so excited to do this panel. And I also travel around and speak to medical professionals, is we're trying to, open up those doors and get them to look more into it and to see these patients and see what's happening to these children in a positive light, and not to be as concerned about, the potential downside of it harming her intellectually. She has straight A's. And she's been doing very well in school. And there was one time that we tried to titrate down in her cannabis oil, because we thought, hey, we got the results we wanted, so why should we keep her on it? So we tried to titrate down, and that's when we discovered how bad her seizures were. And that's when we discovered, how bad without it her pain in her facial area really was. And her grades just plummeted. Her teachers were calling me and saying that they were concerned about her, because she was just so, she was so spacey, and I think the pain was taking so much energy from her and physically that she couldn't concentrate. And in my mind, I feel that, I can give cannabis the credit for the grades that she has.
That's just a tremendous story. Can you share with us the kind of dosing that Riley needs? So
now remember, she takes it sublingually. And so we're actually working right now with, I just got back from Israel, and that was one of the top subjects that was being discussed in Israel that I find very interesting. And so about bioavailability. And so we're actually investigating a way to get the cannabinoids into her a different route, because she does take it sublingually, and she is needing to take about 200 to 230 milligrams of whole plant CBD a day. Now, this CBD has about 6 or 7% THC in it. So it's not the same percentages as like Charlotte's Web or other hemp products. It's more of like an AC/DC kind of percentage. So that is, to me, a lot of milligrams. And if you know the price of cannabis, it's expensive too. Now, the THCA, she's taken about 45 to 50 milligrams a day. And all of this is split up into, 4 doses a day, because it's not time released. When she needs the nasal spray, the THC nasal spray, it's usually when we're traveling, when she's had, dental work, when she's high stress, because she might clench a little bit. It's usually because of the bone pain. So that's a nasal spray, and it works very differently. You don't need as much because of the way that it absorbs. So what I'm looking at, and who I was talking to a lot in Israel were the manufacturers and the doctors who were inventing, inhalers. They were inventing, sublingual mouth sprays that would spray into the mouth and absorb in that way, or even nasal sprays, because you can actually take a much, much lower dose and your body is not filtering it out. It's not wasting it, because a lot of times when you take it sublingually, up to 90% of it is wasted right out. So, not only is your body using it better, but you're not wasting money, you're not wasting plant material. So that's kind of our next step, is to find her a better delivery method.
That is wonderful, very helpful information. Bioavailability and route of administration really is critically important. And, for people taking tinctures or solutions, tinctures being alcohol-based, solutions being oil-based or some other carrier delivering the actives, most children cannot hold something in their mouth for 5 to 15 minutes. And so the bioavailability, right, orally goes down substantially when that medication isn't absorbed through the oral mucosa.
Mm-hmm. Right.
Sebastian, can you share with us the dosing that you're using with Jagger?
Yeah, absolutely. So Jagger is taking CBD, THC, and CBN. The dosing we're using right now, we work our way up to that dose. We obviously started very low and increase it as needed. Jagger right now is taking about 65 milligrams of CBD a day, about 75 milligrams of THC a day, and about 12 to 15 milligrams of CBN a day. We dose CBD 3 times a day. We dose THC in the morning, in the afternoon, and we dose CBN at night. The issue with Jagger that we have is the fact that he has aspiration, so he cannot have anything by mouth. Jagger is 100% tube fed. He has a GJ tube. So we do lose some of our bioavailability, to keep on the same topic, because we have to put it in his feeding tube. We do have some spray. We do have the nasal spray, the same nasal spray that Janie has for Riley. We do have a mouth spray, but we use those just really more as rescue medication for him. Even just the sublingual, the mouth spray could be an issue. If we give too many spray, it's going to be choking, and because of the aspiration. So we do have a bioavailability issue. We are aware of that. As Jagger disease is progressing, we're also seeing a lot of motility issues and absorption issue. So that is a big challenge for us. We are trying to be inventive. We did try and at times use rectal delivery. That get a little tricky. I'm not exactly sure if it works really well for Jagger or if it works really well, as a whole. But yeah, the bioavailability and the absorption issue and the fact it's NPO, nothing by mouth, definitely make it a challenge for Jagger. So we are looking at different options. One thing I just heard of a mom trying, and that's how we rely on other parents too a lot, and other people's advice. I have a mom saying that a kid, when he's having really bad pain crisis, she takes a little bit of concentrate and put it into the belly button, and actually have absorption that way, and it seems to help our kid. I have not tried that with Jagger yet, but that's always, we're always looking for different things and different things that can help us, especially with these issues.
Thank you so much for sharing that information. Hera, can you share with us the dosing that you're using with your children?
So my daughter just recently started taking troches, and so she takes a quarter of a troche in the morning, and then takes another quarter of a troche in the afternoon. So right now for my son, we have increased his RSO to afternoon, a little bit in the afternoon when he starts to get agitated, because I'm trying to wean him off his risperidone. But he gets, again, he's starting to take troches along with strains tinctures. And so he gets 2 mLs in the morning, and then he gets a quarter of a troche in the afternoon. And there's really, there's no fine dosing per se for the RSO, because it's delivered in a syringe, and so it's again the exact dosing of a rice grain or a pea size, depending on the time of day.
What troche are you using?
CBD only, the CBD troche, and then sometimes if my son is still having a hard time sleeping, I'll give him CBD with melatonin at about 8 o'clock at night just to try to calm his body a little bit.
So for the audience, that's troche CBDs are 50 milligrams, and a quarter of a troche would be 12.5 milligrams of CBD in that route of administration and delivery system.
I think it's really good that we're having this panel to remind medical professionals that this isn't about the bubble of, you know, the green rush, that this is really supposed to be about the patient and their experience and their quality of life. But I do think it's important for somebody to bring up that cannabis is not a magic bullet. And you know, I know Sebastian knows that. I mean, for our family, it was almost a magic bullet. Yes, it brought her into remission, but it's not going to, it didn't cure her pain, but it did bring her quality of life, that she can be a normal child. She can go to a sleepover and not have a seizure or not be crying in pain, and have to come home from that, you know, being at a friend's house or having the friend's mom call me and freak out and say, I don't know what to do. She's on the floor, you know, in pain. But there's a lot of cases like Sebastian's that this is not the magic bullet, but quality of life is the big thing. So I think that's important for parents to know, that they're not just going to give their child cannabis and everything's going to be 100% okay.
That is 100% dead on.
So, and you know, sometimes I think that medical professionals, they seem to, the ones that are a little bit doubtful, they seem to fall back on that. And I've had that happen to us where when we gave, you know, we have patients that will, and no, it didn't cure their seizures 100%, but it did make them, you know, it gave them, instead of having 300 seizures, maybe they had 30. And then the doctor came back and said, oh, well, it didn't work. You know what I mean? And so sometimes the physicians who are against it will fall back on that it's not a magic bullet to, you know, to say, oh, well, it doesn't work. You know what I mean? And they're not looking at the positive.
Absolutely. And that is something that I see in the functional medicine arena, where we're using sometimes combinations of natural products along with lifestyle choice changes that have a significant impact on this patient's disease or symptomatology. And, you know, because there isn't a double-blind placebo-controlled trial, they discount it.
Right.
Which is just, I think it's ignorant and negligent on the part of the physician, because, you know, the Hippocratic Oath, you know, do no harm. And many of them do harm by preventing the access, the support, the guidance of what is now found in the literature. The literature, there's a number of studies published in March of this year that are profound as far as guidance. You know, I'm not sure how many medical schools have a cannabis curriculum included. I know that UCSF, my alma mater, has had one for quite a long time. But, you know, at one point in the last couple years, there was only 10 medical schools. That's just a crime.
Right.
Again, we have to figure out a way to hold our elected representatives accountable for the failure of their primary job, which is to listen to the people, our will, and don't harm and hurt us. You know, policies should be based, especially surrounding medicine, on science. And that has never been the case since the 1937 Tax the Marijuana Tax Act was put into place. It was never based on science.
Exactly. That was, and speaking of the double-blind placebo, that was one of the things that was discussed from the platform in Israel. You know, Professor Adi Aram, he's doing the study on autism, and he said that was one of his problems with his study, is because when you're researching cannabis with a double-blind placebo, it's only a matter of like a week or two before the parents know that they're getting a placebo, because you just know, and because you don't have that entourage effect, you don't have any type of quality of life benefits, because you see other patients who are, and it's very hard to hide the placebos into the study, because there's such a drastic difference in the real medicine and the placebo. And he was telling us that, you know, he was having parents come to him on the side begging, you know, can you please switch my child? And he was begging, he was telling them, but you know, please, this is the way it has to be to make it worth it. We have to have a double-blind placebo to get the government to listen to us. And just like you were saying, that like it has to be done a certain way. And, you know, some of us have to suffer along that way, but that's the way it has to be to get the proper studies to show them that this is real medicine and that there is a difference. It's not just in our heads. It's, you know, we're not having a placebo effect with this medication.
Study design can help address some of that. And
right.
When there is a substantial change in the subject's quality of life or symptomatology, there should be a point in time where that is then documented, and then in a crossover design, meaning each patient in the study will have the same condition at some point or the other, even though it's double-blind and randomized. That then, once those symptoms come to a point of patient risk, you know, going back to 300 seizures a day versus 30 seizures a day or 1 seizure a day, you know, there's a point at which still bona fide rock solid science can work within that framework and still document and publish valuable information which guides medical treatment forward with the use of cannabis.
Right.
Sebastian, did you have any other comments that you'd like to add?
No, it's very true. And even if you're looking at, you know, this is not really related to pediatrics, but more to related to do a double-blind placebo FDA study. If you look at Sue Sisley and her work with PTSD and the veterans, then she had to get the cannabis from NIDA, the National Institute of Drug Abuse in University of Mississippi. It took her 7 years to get it. Once she got it, half the study was with her in Scottsdale, Arizona, half with Johns Hopkins University. They tested the cannabis, and it had mold in it. So Johns Hopkins dropped out of the study. So she waited 7 years to get federal government cannabis, the only legal way to get cannabis to do FDA-approved double-blind placebo study in the U.S., and the cannabis is absolutely junk. She can't even use it. And our frustration was, I can go to California, I can go to Colorado, walk in the street corner to a dispensary, have very good quality cannabis, do my study, and move on and have it, get it done right away. Have my supply tomorrow morning. But now I waited 7 years. So a lot of the time we're here, I do a lot of lobbying in Washington, D.C. We're here, we need more research, we need FDA research. But the problem is then we can't get FDA research most of the time because we still have those restrictions and it has to come from NIDA. And the cannabis is just horrible. So it's kind of one of those catch-22 situations where we know it works. We see it with our kids. We see it with other people's kids. We see it with other of our friends, with patients. You see it as a medical professional. We all know that it works. But for the government and for the people in charge of making policies that affect our everyday life, they want that research. They want that FDA research, and the FDA research is not possible because they're actually blocking it. So the same people that are asking us for that research are the same people blocking us from getting that research. So that's a big issue we have right now to get this moving forward.
I feel your pain, and there is no easy solution. I am working with the University of California, Irvine's Center for the Study of Cannabis, and we are trying to figure out how we can use real-world cannabis, not NIDA cannabis, and still provide quality research using something that actually is what is actually being used. No one uses the quality of product that NIDA is providing,
You're right.
at least in the United States that we know of, in permitted states, and the testing that we see from those products that are currently on the marketplace. There's no comparison, and it is a crime that there is at least 20 applications for university-based cannabis cultivation sitting on the DOJ's desk, and they're not approving what was already recommended to address the failure of NIDA's responsibility by the government's, the definition of what they're supposed to be providing. I mean, they're failing miserable at it.
Mm-hmm. Well, yeah, I really hope that, what we talked about in this panel, once some medical professionals, even some governmental agencies, I'm hoping that once they see it, I'm hoping that it plants some seeds, gets them moving, causes some action.
We definitely need it. They need to look at the data that is currently in the literature and recognize even the report that came out in January of last year from the National Academy of Sciences, Engineering, and Medicine, which unequivocally identified cannabis as being helpful in 3 different conditions, one being chronic pain in adults. We're faced with an opiate epidemic, and we have a product that won't suppress respiration, won't make an opiate more dangerous like the other medications that are included with opiates, and it's still not part of any dialogue, both at the National Institute of Health Initiative or in the executive office of Trump's administration.
Thank you.
Well, I would like to thank our panel for sharing this wealth of information, different parts of the country, different conditions, different dosing, different, for the families out there with children, and I run across this regularly, even in California at our clinic. There's just not a lot of support in the medical community, recognizing that California has had medical cannabis the longest in the country, and most referrals come from family and friends to individuals that don't know a thing about it and think that it's a gateway drug, and hear the misinformation in the news media and the lack of information because from their physicians, because their physicians are both afraid of losing their license from the local medical boards, their DEA registration from the federal government. Today still, if a prescriber with a DEA number talks to a patient about how to use and what to use cannabis for, that is essentially aiding and abetting a felony. This has got to change. And with the activism that you all are doing in your states, and with the ability to share your story, which is so profound, and documenting to the world and to our federal government in the U.S. that there is medical indications for cannabis, or in their mind, marijuana, and that the continued oppression of cannabis by leaving it as a Schedule I drug, meaning there is no recognized medical value, is harming our citizens, our children, everyone that could benefit from this powerful adaptogenic herb. So thank you all.